template and performance. And I just want to talk about some things you may find in your practice, and it's kind of an open topic. I want you to let me know if you do find these things out there. But Maddie here has been having chronic headaches and neck pain. You see this come into your office all the time, and occipital eye pain. And what I've done on my assessments is just kind of found this. In the model I'll show you, her atlas, she's rotated to the left. So she's rotating left, and as she's rotating left, it's also giving her a little bit of a side bending on the right. So she's got this kind of rotation. And what it does is I'm finding there's a bump when I'm doing the lamina groove. I'm finding the bump over here on this right side over here at about C2-3. And it's very common, and sometimes you might even find it below C3, C4. And so there would be dysfunction on both sides, because remember, when you got rotation, you got dysfunction on both sides. So you might find muscles tight on the left over here and boggy or loose on this side where it's rotated. And just know that's because the neurology, the brain is shutting one side off and turning one side on. So I see this in Maddie, and I'm feeling that bump, and I'm just going to verify. You always verify with your client. Hey, do you feel this? And so let's just do that verification right now. So I come in, I know my landmarks below the mastoid to the atlas here on the tips of the wings there. Now, once I'm underneath here, I can kind of feel it to see if there's any problem and there's any sensitivity to the atlas there when I'm touching it. No, we've already corrected this part. Now, if I travel down to the C2, C3 area, do you have a little sensitivity there? Yeah, so right there's that bump I'm talking about that I was showing on the model. And so remember, it's a rotational problem. It's kind of stuck. So we want to massage this area, get this stuff loose. Is it on this side too? Not as bad. So you're going to know, and I'm going to show you on the model one more time what that looks like, because it's really confusing. As a therapist, something I used to always get confused about. So when she goes in rotation, it also will drag. You can see this facet joint here, the anterior part of the facet. It drags it forward, and so it shifts a little forward. So when we're doing our work, we're taking it back that direction, and so it should help it settle back in and just take the strain off of the joint capsule. And that's the mechanoreception response that you're seeing for the spasm. So there'll be spasm around that. Know what you're feeling, know what you're seeing, and then we can go in there and work on some side bending and some translation to help get that stuff gliding around, and then start rotating that head and start loosening up all the fourth layer muscles along the spinal groove. Once I've done all those things, I like to do this one. We know it's rotating this direction. It's going to side bend and kind of push this out this direction like this. So what I want to do then is come back in on this side of it and grab the cervicals and then just brace the forehead, and then just start a cervical rotation opposite. Because what it's doing is it's side bending right and rotating right. And so what I'm going to be doing is rotating it back. I'm sorry, it's rotating to the left. I said that backwards. I'm rotating it right. So they're side bending to the right and rotating over to the left. And I'm just going to go ahead and try to rotate that cervical and stretch those muscles on the right side. I'm thinking right side to open that up over there. Feels good. It helps the neck to get back into that natural patterning. Of course, we want to get these shoulders on the table, make sure we're working all this upper cross stuff that we're teaching. I hope you like some of those more examples of just treating headaches and how to help your patients.